Good morning, everyone. I am once again joining you from one of our favorite places, one of our favorite teams that we like visiting with, Academic Alliance in Dermatology. This morning, we're actually joining you from one of their main labs at one of their many offices across the Bay Area. And I'm joined today by Dr. Spohn. So good morning.
Good morning.
Nice to be here today.
It's nice to have you here.
Yeah. We're going to talk about two separate things today when it comes to dermatology. Of course, I know there is a wide range of why people come and see your team of doctors. But one thing I know that we want to discuss this morning is melanoma, and I know this is very personal for you as a doctor, as a family member, and you know how important it is to make sure people are getting checked regularly and as early as possible. Please explain, doctor.
Right. My father had dysplastic moles all through his young adulthood, even had one biopsied that was right in the middle of his back in his 30s. Over a course of probably 2 months in the summer when he was 47, grew into a very large tumor that by the time it was biopsied was unfortunately a metastatic melanoma. So now out of 4 children, 2 are dermatologists, myself and my younger brother.
So that's really kind of changed your career, path. What is it about when you look back at those days and you see maybe where, medicine has come now? From what I understand, I mean, if we catch it early, there is great news that can still be made of melanoma.
It's in the primary care and the annual checkups. So anyone, even if you have a family history or not a family history, if you're very fair and red-haired, or if even if you're the dark African skin type, you could develop a melanoma. And the annual checkup of having a trained, board-certified dermatologist check your skin from head to toe would be the one thing that could have saved my dad's life.
You mentioned board-certified, too, and I know you have a lot of doctors here in this team that are board-certified. Why is that important that you're making sure you're going to the specialist and the doctors who this is their expertise?
Right. So if I have a problem with my foot, I'd want to go to a podiatrist because they specialize in just the foot and not someone who looks at everything. So we are trained for 8 years, so 4 years of medical school plus 4 years of dermatology residency, plus a few other years if someone's doing a special fellowship in pediatrics, Mohs surgery, pathology, cancer in overall, or a specialty in cosmetics. And that's a lot of years of training. And if you ever saw any medical show, you know that it's 80 hours plus a week at the hospital working with patients and families to learn the craft.
Because I think some people may assume, well, you're going and you're seeing your general practitioner, or you're getting your annual checkup, that's, maybe all you need to do.
For some, I'd say that some primary care are excellent in checking the skin, but they are, I think, the best at doing the whole integrated medicine and being the quarterback for the team. So the primary care doctor is #1. He's the quarterback, but the dermatologist is going to be there to specialize in those disorders of the skin. Everything from growths like melanomas to other types of less invasive or less serious skin cancers like a basal cell skin cancer, which if left to grow can be serious, to acute issues like shingles. Eczema, psoriasis, other rashes, warts. We really can help by biopsying that if we need to, or just making a clinical diagnosis, because that's what we do every single day.
Well, and I'm glad you mentioned the different rashes and things, because that's the other second point we were going to talk about this morning, because I've never seen a doctor so excited saying, yes, no, I enjoy looking at rashes. That's kind of my specialty, and it excited you. I love that, doctor.
Yeah, so a rash is a bit of a mystery. It comes a lot from the patient's history, the location on the body, the timing, and the evolution of that rash. And it is absolutely exciting to figure out the cause and help that person clear the rash as fast as possible.
And you say from young to old as well, right? I mean,
early infancy, from the day of birth to over 100 years old. And I've had all of those ages so far here.
Well, as we wrap it up here, what is your take-home for patients when they're maybe searching for a team of doctors, or maybe they are noticing something that, that looks a little off, or I really should have that checked out? What is your take-home today?
Well, whether or not something should be checked out, it always should be checked out. Never assume that it's a nothing. Always get it checked, and then if some expert, checks it and says that it looks okay today, then that's reassuring. But I wouldn't have presume that something is okay, because we don't know unless you have it checked. So that one little thing of just quick appointment, get the skin checked would be the one thing that could be really helpful for everyone.
And at the end of the day, it's peace of mind if it is nothing. So
yes,
yeah.
Yes.
Doctor, thank you so much.
Thank
we appreciate you again, kind of letting us step back into the lab, which I know is very unique for this team as well, to have a lab right here in the offices. Again, locations all across the Bay Area. You're in too, though. Which ones?
I go to Countryside, near the Countryside Mease Hospital, and also Dunedin, right in the outpatient center at the hospital there.
We'll make sure and put all the info on our website as well. Thank you, Doctor.
Thank you very much.